representatives from the occupational therapy element or piece over at Garden Ridge, Erin Keefe.
Correct.
And our representative on the physical therapy side is RJ, Laura.
Yes.
Welcome to both of you, and I hope that you're working hard and doing some progress over there at Garden Ridge. Erin, how long have you been there?
I've been here about almost 4 years working
Really?
here at Green Spring, yes.
And you're on the OT side.
Occupational side, correct.
Yeah. And tell us again what kind of activities the OT side does.
OT side does. Basically, when someone comes to us, they have a change in function, and it can be due to a broken bone, a replaced joint, or just plain illness such as pneumonia or something that will decrease your endurance. So such tasks as getting out of bed, getting yourself dressed, going to the bathroom become difficult. Occupational therapists come in and provide different ways to approach it and to achieve as much independence as possible to get that back. We do exercises, we provide education on energy conservation, and we also provide tools that when certain tasks such as putting on socks and shoes or your pants become difficult. And we just help individuals go through that process.
Sort of getting them the activities of daily living.
Correct.
Bringing them back up to a level of independence
Yes.
as best they can.
As best we can, yeah.
Now, does OT evaluate every client that comes into Garden Ridge, or is it specific?
When individuals come to Garden Ridge, we do provide evaluations to
Okay, to
everybody
see if
that
they
comes
need
in.
your
Yeah,
services.
to see everyone who comes in. We'll do a visit if they need to work on those things. We will work with them.
Are you primarily dealing with people that are in the rehab end? I mean, they're just there to recover, as you say, from these various things, or what about the long-term residents?
Long-term care residents, those who remain in the Garden Ridge, if something changes, then nursing will make a referral or recommendation, will come up and see if they would benefit from the therapy.
Yeah.
So such things as if nursing's noticing someone who was feeding themselves prior, they're having difficulty feeding themselves either to change of energy, they're not able to tolerate as much, they have a change in their hand function. Occupational therapy will go in and assess and see what we can do to help out.
How many OTs are over there?
We have about 4 to 5 at this time. So,
And you told me before you went on the air that sometimes you both of you would go over to outpatient if you were needed. And I suppose some of them will go over to Garden Ridge if they're needed. Is that correct? Yeah. Where'd you get your training?
I went to Duquesne University up in Pittsburgh, but I'm from the Fairfax area.
Oh, okay.
So they just had a really good program. And so I went up there not knowing anybody in Pittsburgh, but enjoyed my 5 years up there.
Oh, it takes 5 years to get a...
It varies depending upon the program you go to. Right now, occupational therapy requires a master's degree. So it depends upon what program you go to. It can be anywhere between 6 to 5 years to get the master's. So.
Well, let's switch over to RJ and your physical therapy.
Yes.
What are the challenges there? I mean, what kind of clients are you seeing there?
Like what Erin said, we work with residents who fell and who had a decline in their functional mobility level. Let's say for somebody who's independent, walking without any assistive device, had a fall for whatever reason, broke, let's say the left hip, and because of pain and non-weight bearing precautions, then it will take them time to recover. So we're working with people, and of course, aside from the functional limitations, personality, character, motivation plays in also. So it's a very dynamic environment, because again, everybody's different, and our job is not just to get them physically strong and independent, but to motivate also. I
To
think
believe in themselves
Again,
again. That
yes.
yeah.
yes.
Because when we're older, things can kind of put us down and be harder to get up.
not just when you're older. Everybody goes through the same
Everybody,
cycle. I mean, imagine you being independent and then all of a sudden relying on somebody else to get you up on the bed, even up on the bed. So it takes.
Well, I see what you're saying, because sometimes just needing assistance is just real aggravating, that you can't do it on your own. That you need
Yes.
somebody to help you do whatever this is. Yeah. Now, do you have any occasion to come over to independent living apartments, or is that strictly outpatient rehab doing those?
There are opportunities for us to do home safety assessments. Sometimes, someone has a change in the independent living apartment, and they'll be referred to either the outpatient department or the home health department, and they will sometimes have us go over there and complete it over there.
Are you all under the umbrella of home health, or not? No, you're
that's-
under the umbrella of Garden Ridge. Okay.
And sometimes, as needed, we do home visits prior to discharging a
The
patient
transfer, yeah.
to make sure that everything is in place. Even though home health will follow up them, we're preparing them and making it easier for home health.
That's good. Well, it's a whole team effort, isn't it?
It is.
Definitely.
Yeah. So anything new in those areas? Like, is there any new equipment? Do you all have you have a separate facility area where patients come to your room to do their physical therapy, or do you do it all in their rooms?
We it's pretty flexible, our options. We have a main gym in Garden Ridge where we do
Okay.
where PT and OT do work together.
Okay.
And then we also, occupational therapy, for example, if we need to work on the dressing skills, we will go and work in their
Oh,
in
that
their
makes
individual
sense. Yeah,
rooms.
of course.
So we have a flexibility there.
Of course.
So yeah.
And generally, do you find that you have the same patients, like they'll do one effort with you and the same patient will be using PT, or is that not so?
Yeah.
It's a team.
Team.
So depending on the needs of the patient,
Yeah.
that's why we do our evaluation and recommendations.
Right. Now, you're not the only therapies over there. You have speech therapy too, which
Yes.
I'm sure those, especially if have strokes or whatever, would need.
Yes.
Do you have a need to work with that? Does OT come into speech therapy anyway? I mean,
There, sometimes we do something called co-treatment. A lot of times what happens is there's a lot of good team communication. So if occupational therapy is working with the resident and we're noticing they're having a difficulty swallowing or they're coughing a lot when they're drinking, we will make a referral to speech. We'll go to the speech therapist and be like, we're noticing these things. Will you be able to take a look? Speech will notice a change in their hand function or how
see.
their
Sure.
posture
Again,
sitting up,
yeah.
and they'll refer that individual to us if they're not already on caseload.
Okay.
So we'll go into
You have a
it
big
together.
caseload?
We have a decent sized caseload.
What do you
yeah.
call a decent size?
Oh,
6 to 8 patients a
6 to
day.
8 patients a day.
6 to 8 a day. Well, you give them
It's a full
about an
day.
hour a day. Yeah, I mean an hour a client. So
Yeah.
that would be your day. Then you have to do all the paperwork
Yes.
or the computer input or whatever.
The billing
Yeah, you have a lot of other
and
tasks.
care coordination with family, with the social worker, with nursing,
Right.
with the doctor.
Right.
There's a lot of behind the scenes that we do because again it's a team effort, and when especially when we're about to discharge a resident back to the home, we have to coordinate all the equipments, all the recommendations, home support, home health. So there's a lot of behind the scenes tasks.
I hope one of my good friends is listening to the show today, because she's about to have knee surgery after the first of the year. So
Okay.
she'll be there.
Okay.
It's been we've been in operations for what, more than 10 years.
Uh-huh.
So there's a good system in place already.
RJ, where did you get your training?
In Manila, Philippines.
Oh, okay. Okay. That's your place of birth?
Yes.
Okay. How long have you been in this country?
About 13 years now.
Uh-huh. And you've been at Green Spring for how long?
10 years.
Oh, wow. Old timers. Okay, well, is there any new research that you all are trying out or testing with your clients, or anything on the horizon that you can see in the...
Something to look forward to is the new building that's about to come. We'll have
yeah.
bigger space and more equipments.
Uh-huh.
So depending on what we get, then we'll get new technology. We have the Omni VR. It's a new system. It's like the Wii Sport.
Uh-huh. Yeah.
But it's more geared towards balance, cognition, coordination. So it looks like a game for residents, but we're actually working on something more skilled. Like
Well, that's good. Having gone to therapy myself, outpatient, because of a broken shoulder, it was interesting. The kinds of equipment that I used were the simplest things. A cane, lifting a cane up over my head, that kind of thing. Once I even learned how to lift my arm up over. But things like just crawling up the wall with my fingers, and they were things that you didn't need a lot of room to do. I mean, it could be done pretty.
The important thing is the purpose of the exercise.
Yeah.
So when you're home, even without the finger ladder or the pulley, you'll know that, I have to do this motion because it's for this purpose.
Exactly.
You don't need fancy equipments.
Yeah, exactly. Well, I think that was what I was getting at. You don't really need.
No.
However, if somebody's in therapy a long time, it could get pretty boring.
Yes.
Going in and doing the same thing every day. Well, look, we're about out of time, and it's been lovely talking to you, and I hope our residents, if they have an opportunity to see you, it's with a good result. Thank you very much for coming.
Thank you.
Stay tuned. We're going to have a little roll in on the art wall, and then we'll be back with our board member, representative.